today we wanted to talk about the spreadsheet that we rely on every year when it comes to open enrollment. Every step, every touch point, every website we have to open or thing that we have to click and wait to load adds time. Ultimately, if you have to click something 300 times or 3 times or 30,000 times, each step in that process exponentially gets more and more bogged down. We've been using this spreadsheet to just simplify our life during open enrollment. The first thing I will show you in this spreadsheet is there are two specific examples at the bottom. Look around in here to see how we have our structure. If you right click on these when you're ready to go for open enrollment, you can go ahead and hide a sheet. You can do the same thing for this guy here. And at least if you keep this inside of a Google Workspace account where you have a BAA on file, it's HIPAA compliant. Otherwise, feel free to download it as an Excel spreadsheet and keep it locally for yourself. We use Google specifically because, one, we're HIPAA compliant, and two, everyone on my team can actively be in the file, making comments, making updates, and we don't have to worry about versioning. We don't have to worry about, is this the most current Excel spreadsheet or whatnot. We do use this pretty heavily during open enrollment. The first thing that we like to do leading up to fourth quarter is we like to take our existing book of business from any source that we have and load it in and create an inventory of our client base. This structure here, as far as first name, last name, income, date of birth, dependents, this is all information that we would have readily available in, let's say, Health Sherpa or healthcare.gov or all of our carriers that we deal with when it comes to Medicare, Medicare Advantage, and Part D plans, when it comes to our employer plans, and when it comes to our state-based marketplaces like Penny, Get Covered New Jersey, Maryland Connections, Be Well New Mexico. We take all of that data and we put it in here. And this right off the bat allows us to see, do we have all the necessary data within here so that we're not referring to all of those different systems during open enrollment. This spreadsheet is very cut and dry. If you go to this example page, you're going to see that we would put a client's first name, last name, their income that we have on file, date of birth, the date of birth for the dependents. We're really just trying to make sure that we have the dependent dates of birth, specifically related to dependents that we have to include in the household, but are not seeking coverage. When you're in here, you can highlight any particular date of birth, just throw a strike line through it. And we keep track of who we have and have not run quotes. This prep file is going to be different from the OEPW file, which is ultimately what we turn on or what we start using for open enrollment. This file is a bit different. It doesn't have all the data about the household. It more has a very quick view of client's name, what line of business you're dealing with, when did you have a meeting if you had a meeting, when do they need coverage to start. This is more if I have someone that comes November 15th and they need a 12/1 start date. This becomes a way of keeping track that everyone isn't 1/1, just a way to very quickly see if there is anyone we need to prioritize. Notes, I'll get to that field in a bit. Research needed. If I have a client engagement and they say, I take Jardiance, I take this medication that I'm really concerned about making sure it's covered. From here, we have a drop-down list of pills, doctor, both, or nothing. It's just meant to be a very quick thing to see, right? If one of my service team is in here and they see a pill bottle here and they see a doctor here, they know those are outstanding things that are needed before a quote can be sent to a client. They can start doing the research. Once that piece is done, it's removed from the field and it's not adding more clutter to the sheet. Quotes emailed, we prefer to put in a date of when it was done. We'll put in a date here, enrollment status. If in here I send a quote and I haven't gotten a response back from a client, this may be put into a waiting status. The moment I move this to a need to be enrolled status, this row automatically highlights as this is ready to go. Come on, let's get things done. And then after that DMI, there is a DMI, or again, I wind up leaving that blank. If there's a data matching issue that you have, you can certainly use this structure. You can also edit the structure and change it to the type of DMI, whether it's citizenship or income. That's really up to you how you want to set the system up. Plan selection, this is where we throw in whatever the plan is that our client picked, the plan name, the premium, the APTC amount. And then as you can see here, coverage added to the CRM, whether it's done, and what we have here is whether it's really done. We actually have this kind of set in two different phases. It's done puts it as kind of a light green, and the whole point is that during open enrollment, anything that's green does not get my eyes on it, right? They're enrolled. I don't need to worry about that anymore. We're all set. After open enrollment, we go back into our CRM, we put the notes in, we put the plan information in, and that's where once those pieces have been done, if you check the box, then it's a second layer of green. After open enrollment, I can see all of the light greens that need something to be inputted into the CRM. And as I mark those off, they turn to dark green, and I'm only focusing on the light side of things. Revisit after open enrollment might be that someone says, hey, can you talk to me about this retirement plan that I have? Or I have additional questions about, I'm getting married later this year. Or I want to talk to you about Medicare and I'm going to be turning 65 in June. Those are split decisions during open enrollment where we'll say, hey, we want to help you with that, but right now we have such a finite time to help all of our existing clients and help anyone else that comes to us. And we have a finite deadline of December 15th if people want coverage for January 1st, that we need to focus on that deadline and focus on everyone that needs to be supported for that deadline, that we want to talk to you the second week in January. This checkbox here just allows me to mark off that we're not really doing anything for that client. We're moving on. Now, in the beginning, as far as line is concerned, traditionally what we'll put here is or IFP, short-term medical, STM. In this case, we're running both to compare what's better, what's worse. Medicare Advantage or SUP, major medical and CHIP. We know the parents are going to be on major medical. We know that the kids are going to be on CHIP. Dual eligible, we're looking at likely a DSNP in that case. Groups here as well. We're making a quick note of the line that we're talking to the client about. If they mention that they want dental and vision, we're putting all of that here that we know that quotes have been sent. Now, the thing that you're going to likely update right off the bat is responsible party. Responsible party, in our case, would be any of the team members, needs a quote, attention, waiting, auto renews. We wind up having this, the kind of the last four, that when we're in the first or second week of December, and we're really just trying to go through whatever still is white, whatever still has not been assigned to somebody. We have this first column really focused on what needs to be done throughout the open enrollment period, when we actually, the broker's on the phone and they're talking to a client, and then they're assigning a task over to a team member. They would throw in the responsible party as whoever that person is that's stepping in. I say that you can edit it. Again, if you click this button at the bottom, you can actually change who your team members are that would be associated with servicing, whether that's all of the brokers, staff, or if you use a sheet one per client base. If you have 10 brokers and 20 support staff, and each broker, it's really kind of one broker and 2 support staff, or 2 brokers and 4 support staff that are managing this cohort of clients. You don't necessarily want to overwhelm this menu, but you want to put the people that would be looking at this particular spreadsheet daily. This essentially breaks down all of the work that we currently have in the hopper. And the way that we have it over here is, if I change this from Josh to Aislinn or to Erica or whoever, it changes the color that they know that they have to work on something. Whatever names are listed here in this first column that you finalize, going to format, conditional formatting, we basically set, if the first column is that name, then we're picking a specific color. So if the first column is Aislinn, then we set that color to whatever we decided. And that allows us to have a different color for each one of us. If they're auto-renewing, we just kind of leave it. We have this person that's just like shrugging because it's usually a client hasn't responded to us, and we have listed them as auto-renew at this point. The last thing I will point out is the notes column. Now, my team is spoiled. Every single one of my team members has it's a keyboard. It's a Corsair K55. I'm only saying that because if you wanted to get one, that's what we use for our keyboard. The benefit to the Corsair is that it has extra buttons on the side that you can assign to either do tasks or assign to a different key. And the way that we have our system set up is that I actually have on my keyboard the colors: blue, yellow, pink, green. Those colors are associated with the notes that are here. If I type a button, I can add colors here. What I can do on the fly is I can put in a blue, which is something that I need done. I'll put in the date, the initials of the person that's making the note, and put in anything. I'll put in like, Abby, can you look up Jardians and see which carrier has the lowest. Now I can come in here and change it to Abby, and Abby can come in and see, okay, this was assigned to me. I have the note here on what I'm supposed to do, and Abby's going to come in, and what she'll do is she will go and do that work. She'll come back, and she'll mark this as green. She'll take her name off of it. Let's say on your team, Erica is the one that does the quotes. She may assign it to Erica and put in here, RX research, put in the client file for review. Erica, please quote and email to. All of these notes are kind of put in on the fly, and then each team member is taking over once it's been assigned to them. the purpose behind this. We're not having to leave this spreadsheet during open enrollment. There's less kind of maneuvering to other places. We have one source of truth when it comes to our client base and assisting them. I hope this helps you understand really what is behind the open enrollment tool. The last thing I will point out is that when you get this file, you're going to see that it is locked. We share the file for viewing only, and that's purely because we don't want to share a file that you can edit and then you start typing in your client information and then someone else goes to the file and starts trying to put in their client information and they see yours. We share it as view only. The idea is if you are going to use it as an Excel spreadsheet, you can go to File, Download, and you can download it as either a Microsoft Excel sheet or a CSV file. If you are going to use it inside of Google Drive, then you do the same thing. You go to File, make a copy, and you can make a copy to your Google Drive within your organization. Anything you do input, once it's a copy, it's local to you and no one else can see what's being put in. Your client information is protected. I hope that addresses how the system works. If you have any questions, don't hesitate to reach out. But we did want to provide this as a tool for brokers that have leaned into us for the consent portal. This is what we use every open enrollment, and we hope that it helps you, this open enrollment, support your clients, simplify your staff workflows, and ensure that you have a better and more successful open enrollment. Thanks, everyone.